Hello and good afternoon, Senator Crawford. My name is Angela Bentley and I am a constituent of yours. I'm a registered nurse and I work at Vidant Medical Center in the Central Staffing Department. I've been a nurse for over 18 years and I've worked in many different clinical settings. Absolutely love my job. However, I'm here today to talk to you about Suicide Prevention Lifeline Act of 2021. Suicide remains a major healthcare problem in this country, in the United States. There are countless suicides per year. In fact, according to the CDC website, every 11 minutes, one person commits suicide. Suicide affects everyone. The latest statistics that I saw on the suicide on the CDC website was ages 10 to 64 thought or have committed or contemplated suicide in their lifetime between ages 10 and 64. That's everyone. It is preventable. We definitely need to get more resources out to the community, easy and accessible resources. When I looked at the numbers, according to the CDC website, over 12 million people attempted suicide back in 2020. It is the 9th leading cause of death in individuals between 10 and 64 years old. At least 3.2 million people have thought of commit suicide, have come up with a plan. 12 million have thought of suicide. 3 million have come up with a plan. 1.2 million have attempted suicide back in 2021. These numbers are staggering. They're mind-blowing. My 16-year-old daughter has lost 2 friends, 2 classmates to suicide in the last 6 months. When I was growing up, I don't remember hearing about suicide this much. It has become a disease in itself. I feel like now that maybe because I'm in the healthcare field, but there's a lot more people trying to hurt themselves or commit suicides. We need to make sure that the resources are available, easy accessible to individuals, to people in our community, in the schools, and nationwide. And so the amendment to this bill will make it easier for the phone calls, make it accessible, where there are backup phone calls. So if an individual calling and the phone lines are busy or they're tied up, that there's a backup phone call that someone else will take that call. Because when you're in a crisis, you don't have time to wait. So you want to make sure that there are someone on that line available at all times. It doesn't matter what time that you're calling. Also, making sure that there are resources locally in our community that people can get to access. Providing privacy, making sure that we're also following up with people who have called in, who have thought of committing suicide. Someone else is reaching out to them and following up with them days in advance, weeks and months even. Providing resources, food, shelter. Sometimes people try to commit suicide or attempted suicide because they can't pay their bills or they don't have anywhere to live. They feel hopeless. What are we doing? Our young people in our schools as well are thought of suicide. They're depressed, providing sufficient mental health care for these people. So we need to make sure that they're not worrying about how they're going to pay for it, but how they're going to, where they can get help and making sure that that help is available to them on that end. And it is ready and available. And we're not extending our hand waiting for money or payment, but just making sure that it is available, easy and accessible, and making sure that they're comfortable when we're extending that help for them. So training our healthcare personnel as well to provide sufficient help for suicide prevention patients. I am asking you, I'm pleading with you, I'm begging for your support on this bill. Thank you.